Welcome to Team Time. I'm your host, Gordon Coombs, the Executive Director of Team Wellness and Prevention. Team is dedicated to promoting healthy lifestyles through the prevention of substance abuse. Team promotes youth, health, and wellness to prevent substance abuse. We work with community organizations, schools, families, and individuals. From mentoring programs that help youth make healthy decisions, to partnerships with alcohol retailers and dispensaries to ensure their safe service and sales, we believe that the community is the team to propel youth to reach their true potential. Team Time is a monthly information series presented by Team Wellness and Prevention. Team Time tackles tough issues surrounding substance abuse in our community with subject matter experts. This month on Team Time, we are talking about Larimer County's Mental Health Matters Initiative. Our guests are Lori Stolen, the Behavioral Health Project Director for Larimer County, and also Officer Chris Wren for Fort Collins Police Services. As a little background on this month's Team Time, Larimer County is experiencing unprecedented growth as it relates to mental health challenges. Suicide has doubled in Larimer County since 2009, and we continue to have among the highest suicide rates in the nation. In 2016, 83 Larimer County residents took their own lives. Sadly, the current mental health system in Larimer County, while it does provide some high-quality treatment and services, does not meet the demand of people in need. Lori, tell us a little bit about you and in the Mental Health Matters.
Perfect. Thank you very much. So I've been with the county for 20 years, and I joke with most folks and say that I spent my first 13 years in jail. So Gordon would go out and get them and then bring them to the jail and in programs unit and inmate services and mental health and a variety of different education programs that we did at the jail. Do our best to try to intervene and send them on their way. I moved over to the alternative sentencing department in 2010 and really began to understand the impacts of mental illness and substance use disorders in the criminal justice system, and how much money we were spending in criminalizing people that really could be served better in getting the right level of treatment that they need in our community. It's very costly. We are overutilizing our most expensive resources in our community, and that unfortunately reduces the quality of those services for people that truly need, like the emergency room, for example. When the emergency room is full of people detoxing and in mental health crisis, those beds are full of those people that sit there for hours and hours and hours waiting for an appropriate bed or an appropriate level of care somewhere else that just doesn't exist in our community. So in 2013, the county revised their 5-year strategic plan. 2013 to 2018, the 5-year county strategic plan includes 7 goals, and under goal number 1, safety and well-being, there's an objective that says by 2018, the community and community service providers will work together to fill the critical gaps in behavioral health care, including opening a multi-service center to provide treatment for detox, residential substance abuse, and crisis services. So, in 2015, I took over as the leader of that objective to see if we could make some impacts in our community. And we quickly got to work on the research and the data behind understanding what our community currently offers, what we do really good, and then we are able to look at all the systems and where people are currently getting care, where people currently are and they're not getting the right level of care. We looked at the outcomes of people, the recidivism rates of people throughout the criminal justice system all along the way, from jail to our alternative programs, to community corrections, to probation. We continue to see people getting worse, getting unhealthier, and continuing to come back into the criminal justice system. We learned about hundreds of people in our community that were calling 911 multiple times a day. Ambulance come to their house multiple times a day. And the paramedics are like, wow, medically, you're good. No, but this. Crisis, need support, need a different level of care, not an ambulance. People going to the emergency room 3 or 4 times a day. You don't think that's expensive? You walk in the door of the emergency room and it's an automatic $2,500, right? And then an add-on for everything extra.
And these people sit in there and they're not getting the level of care or the follow-up or the ongoing treatment that they need to become stabilized. So we learned that people were living in crisis, from crisis to crisis. Crisis is supposed to be short-lived. You know, we all may have a crisis in our life, and we all have different levels of resilience and resources that help us get through those moments of crisis. But unfortunately, the current services that we have in our community are woefully inadequate for our growing population of people in need. So we went to ballot in 2016 to ask for a increase in sales tax countywide to fund a long-term financial solution to fill the gaps in our behavioral health care system. And that 0.25% sales tax, or a quarter on $100, that's $12.50 on $50, 12.5 cents, that is, on $50. A very small investment to make in our community for the significant impacts that it can make. We lost the ballot in 2016 by 7,000 votes. And so on November 9th, my head was still spinning, and I was kind of set back a little bit, and I went to the commissioners. I'm like, okay, now what? And they said, well, what we know is that the problem is not going away, and it's still a priority, and what we want to do is to move you out of your position as the alternative sentencing director and put you into a full-time project position to go out and understand why it failed, and if there's a possibility of going back to ballot for this issue. That's how important it is, and that's how much of a priority it is for the county. So since then, November 10th of 2016, I've spent that much time, 18 months or so, understanding the political environment and the growing needs and the complexities of this behavioral health system in our community. So we have revised the roadmap, the report, and we are looking at going back to the ballot in November of this year. So we have it on the schedule already to go to the commissioners on July 24th. So write the date down if you want to come and support that. We'll have it at the commissioners' hearing room and ask them to refer this issue to the ballot again and hopefully get the long-term funding that we need to truly make some impacts in our system. So that's me.
So let's talk about mental health and behavioral health. First of all, is there a distinction between mental health and behavioral health?
It's a great place to start because of this term, behavioral health. Most of us that talk about it a lot wish that we could go back and find that person who coined that phrase as the umbrella term for mental illness and addiction or substance use or substance abuse disorders, all this language. Behavioral health, honestly, is a terrible terminology because the last thing to change with any chronic illness is behavior, right? And it really portrays a picture of the wrong thing that we're talking about. Behavior might be something more related to the criminal justice system. Bad behavior, criminal behavior, well, then you lose your freedom and you have to be incarcerated. But when you're talking about a chronic illness, we don't talk about someone having a behavioral issue with diabetes or with asthma, right? So why is mental illness coined as a behavior problem? So it is an umbrella term that we don't really like, but it kind of covers the mental illness and addiction piece of these chronic illnesses.
Okay. So what is the mental health, behavioral health crisis in Larimer County? I mean, from a broad view, kind of high level view, is it a crisis? That's what we hear a lot. What's your assessment?
So if I could just share some of the stories that continue to come in every day from the people that are struggling with family members, themselves, their children, their parents, their neighbors. It impacts everyone. And when the care that is needed isn't there, it is most definitely a crisis. One of my favorite stories is of a female that came forward on her own in 2016. Her name is Amber Phipps, and I respect her deeply. And she said, I have a story that should be told. I don't think that this experience that I went through should be left without people knowing about it because it speaks to the severity in what's going on in our community. And her story goes just very quickly that her and her husband married. He was an alcoholic, and they decided that he wanted to get some help. And so he quit drinking on his own, and about 30 days into his withdrawal, he started having some symptoms and going into true alcohol withdrawal, which is, one of the substances you can actually die from with alcohol withdrawal. So they went to the emergency room, and they cleared him medically and said, "You're good to go." He knew he wasn't good to go, and they went back home. And shortly thereafter, went back to the emergency room. He was having just terrible hallucinations and delusions, and the bugs crawling under his skin, and he just felt horrible. They said, "We can't do anything more for you here. Medically, you're cleared. Why don't you try the detox over in Greeley?" Well, this is like 1:30 in the morning. They send him over there. They get over to Greeley, and they're full. "Why don't you go down to Denver? You might try Arapahoe House in Denver." And they're like, "Well, I'm not driving to Denver at 2:30 in the morning. Maybe we'll look at Denver in the morning. Let's go home and see if we can just sleep it off." They went home, tried to sleep, couldn't, pacing the floors. A few minutes later, went outside to have a cigarette on their back deck. And the next thing Amber knows, her husband is standing behind her with a knife, slitting her throat. The voices in his head told him that he needed to kill his wife. He had no option. He was convinced that was what he was supposed to do. These hallucinations from alcohol withdrawal. The kicker of the story is that her husband is now spending 15 years in prison for attempted murder. Because the right level of care was not in our community when he needed it. So if that's not a crisis, I don't know what is. And this is one story of hundreds and hundreds and hundreds. We anticipate that at any given time there are 1,400 people in our community, in Larimer County, that want and desperately need care at a severe or persistent level. So not just someone struggling with a little bit of anxiety, not a minimal level of care, a severe or persistent level of care. Over 1,400 people at any point in time that need and can't get the level of care that they need. That number is going to continue to grow. We know in our jail that over 30%, which is just a national number that we go by, and we have verified it locally, that there are over 200 inmates in our jail that have mental illness and are not getting the treatment that they need. We also know that the number of folks in our jail that have addiction issues probably pushes 80 to 90% of the people in our jail. And what we know from information and research that we've done is that 99%, that doesn't leave a lot of whole wiggle room, 99% of the people in law enforcement know for a fact that you go out and you rearrest people all the time. 99% of the people that have addiction issues that go into jail, they don't get the treatment that they need, which they don't because it's a jail, will be released from jail and reuse. So the worst part of that is what happens is that in the jail they actually withdraw. They detox from the substance because most people don't get to continue using in the jail, right? They sober. When they get out, their body's tolerance level has been reduced to those drugs, right? But their craving, the addiction has not been addressed. So they get out and they reuse at the same level that they were using before they went into jail. Guess what happens?
They go back.
They overdose.
Oh.
They go back into this crisis system. So we have got people that are continuing in these levels of crisis, surviving purely from the Narcan, from naloxone, that they can give them to reverse overdose incidents with heroin and opioids. They're surviving because Narcan is available now, If that's not crisis, I don't know what is.
And that's a great segue, because I was going to ask you, who does this impact? And I'm going to be a little sarcastic here, but and so forgive me, but those are all the bad people, right? Those are just the bad people that are getting into trouble and having addiction issues. Those aren't like normal law-abiding citizens. The good people of Larimer County aren't really affected by it, are they?
Right. So that's the kind of thing that perpetuates the stigma, that kind of sarcasm right there. So if I was closer, I'd hit you.
I can throw from here.
This isn't an us and them. We have a small crowd of people here today, but I can almost guarantee you that every one of you knows someone, if not yourself, every one of you knows of someone that has experienced mental illness or substance abuse addiction issues.
19 years sober, right here.
There you go. So we've got a lived experience right in the room. I just spent the last 2 hours in the emergency room with my best friend, with panic and anxiety and stress through the roof that she needed to have extra support and intervention because of, physically what stress is doing to her. So this isn't an us and them. This isn't just the bad people. Unfortunately, those that get all of the attention are the ones that are most visible, right? Homeless Joe on the corner in downtown. Everybody sees him. Everybody knows him. The guys from Austin's restaurant take good care of him and feed him every day. And, he's got mental health issues and everybody just placates him so he doesn't, cause an uproar and doesn't end up in the jail and cost people lots of money to house homeless folks that have mental illness. That is such a small percentage of the people that are going without the care that we need. What we know for sure is that mental illness and addiction knows no bias, knows no boundaries. Every socioeconomic status, every religion, every political bend, every age, every culture, every race, it does not matter, because mental illness and addiction, just like any other chronic illness, is not biased on those bad people.
Thank you. That's exactly what I was hoping you would say. It's so often it seems so stigmatized, and we do events and we talk about substance use disorder, and there are a lot of people that don't want to raise their hand, so to speak, and acknowledge that that's part of their life, and they don't want to hear it because they're afraid of the stigma that comes about. And I think one of the big challenges for us as a community, and I think possibly as to why it didn't pass the first time around, is related to that stigma. And if we can talk about how it impacts everybody and instead of that dark, ugly face to it, put a face that we all know, that we've all been impacted for, that can hit anyone. So is this a new phenomenon? It seems like this crisis is really kind of exploded in the last couple of years. I can go back in my law enforcement career and remember situations. But why is it kind of coming to a head now?
Sure. I want to finish one thought that I had back on those people, and then it might lead into where we are today. What we're seeing in those bad people is an outcome, is a result of not doing better. Because what happens is, just like someone that doesn't take care of their diabetes, if you're diabetic and you don't take care of yourself, what do you eventually get? What happens? You may have to have a toe amputated, or even a foot amputated, or you could go blind, right? These are the worst cases of people that haven't taken care of themselves who have diabetes. Asthma, you don't take care of your asthma, you could die, right? You get COPD, it could turn into emphysema, it could turn into these more deteriorative, worse health conditions. It's the same thing with addiction and mental illness. If we catch them early, we identify them at the start, or when the symptoms start to show themselves, then we can get somebody on the care that they need and maintain stability. But when we don't, what happens is people start to deteriorate into this very complex system of medical problems. Because if you don't have your behavioral health taken care of, your mental health, you're most likely going to become less physically healthy as well. Your finances become more strained because you've lost your job, because you can't get up in the mornings because you have mental illness or addiction. When you have mental illness, you don't feel good, and oftentimes people begin to self-medicate. Maybe the mental health meds that they were on don't make them feel good because they have a lot of side effects. But they don't quite know how to describe what they're feeling. They go back to their primary care doctor, and they just put them on another med because they're not really sure about this mental health thing either, because they're a health doctor, right? Not a brain psychologist, psychiatrist. We have a 12 to 16 week wait list in Larimer County to see a psychiatrist. If you're in a mental health crisis and you've broken your leg, do you think you could wait 12 weeks to go see the orthopedic doctor for a broken leg? If you were in a asthma attack, or you were in diabetic coma, you call the ambulance, do you think you could wait 12 weeks to go see the pulmonologist? Or the mental health and addiction are the only chronic illnesses that we know of that we wait until like a stage 4 to deal with. So it's frustrating. I guess you can hear that a little bit of passion in my voice. We've gotten to where we are today because we haven't done good enough for a long time, and things continue to deteriorate. And so what we've done, and I can brag about this, in Larimer County, we've got a really good criminal justice system. Honestly, we do. I'm not saying the criminal justice system is an effective system or that it works well. It's frustrating, it's very difficult to get out of, and it's expensive for sure. But we have done a lot of things on the intervention side, but what we haven't done is a good enough job on the front end to avoid the problem, to prevent the problem from getting bad. And so we've reacted, and we do things like emergency rooms in healthcare, and we've got a great cancer center. And Summit Stone is just growing and growing and growing in their capacities because we've got more and more people in these needs. And I can take it clear back to, not to give a history lesson on mental health in America, but in the 1950s, there was a humanitarian uproar that said psychiatric hospitals are inhumane. Psychiatric hospitals are keeping people in cages, and it's not the right way to treat people. There are emerging medications, and there are emerging practices that don't require people to be locked up in hospitals. And so the federal government said, okay, enough research to deinstitutionalize these people that we have, removed their rights, removed their freedoms, and locked them up in order to get them back to a level of competency. And so in the 1950s, when the federal government defunded Medicaid reimbursement for institutes of mental disorder or psychiatric hospitalization, they said what we'll do is we'll take all of that funding from the Medicaid stream and we'll just fund community mental health around the United States through these federal block grants. Communities, you'll trickle down community mental health. Summit Stone is our designated community mental health provider. And let me assure you that to this day, 68 plus years later, we still have woefully inadequate community mental health care. And so we've got generations and generations of people that have continued to go without the care that they've needed. We know that there's some genetics behind some hereditary issues to some mental illness and some indicators for addiction that run in families. And when you don't take care of those things early, they continue to come into a crisis level of care, which is where we find ourselves in our community today.
So tell us about the vision for this behavioral health campus, and how is that what's the vision first, and then how is it going to help impact this crisis?
Sure. So let me first start off by saying that there are some places around the country that are doing it better than us. I think we're 46th out of 50 states in behavioral health care funding. We're woefully behind in our behavioral health care funding and support. Our suicide rates are dismally embarrassing, right? One of the highest suicide rates in the country, Larimer County, one of the highest in the state. I was just at recently a presentation that was talking about suicide is the leading cause of death for ages 10 to 24. Leading cause of death. Leading cause of preventable death. Suicide. And what we know about people that die by suicide is that there is usually 90% or so have an underlying mental health condition. And this is the outcome that we've gotten to, where they have so much pain and no other resource, no other alternative, except they're out of suicide. I don't feel like I need to say anything more than why haven't we changed the way we're doing things? And we're just going to accept that statistic. 117 teens a week die by suicide. We know that addiction and mental illness go hand in hand, with suicide being an outcome. So this project has been following some of the best practices in the nation. We've looked at the data, we've looked at the research, we're looking for places that have strong outcomes and returns on investment, because we know that treatment costs. You can't do it for free. If it were free, we'd be doing it really well in our community now. We've asked all of our community service providers, why can't you just do this? And they say that we can't do it because we couldn't keep our doors open. We can't afford to. Insurance and Medicaid reimbursement only pay 30% of the amount that's needed for the levels of care that, people that don't have enough money in their pocket to pay pay outright for it, 30%. So that's 70% gap in the pay that's needed to give people the ongoing care that they need. Could you imagine if someone had cancer and only 30% of their care was paid by their insurance? We would be in an immediate uproar as a society, I believe. And so the conversation has strengthened around our nation and statewide, and fortunately, I think locally as well, the conversation has raised to a point where we've gathered the information nationally on some of the best practices, where our most critical gaps are in behavioral health care. I think I've asked the question too many times now because everybody knows the answer of where is our detox in Larimer County, because everyone says, we don't have one. No, you're right, we don't. We don't have a detox in Larimer County. And so folks that need to get withdrawn from whatever substance that they have difficulties with, they've got to go to Greeley. And that's 35 miles away. And Greeley's full. Greeley's detox unit through North Range Behavioral Health is at capacity. And people are getting turned away all the time. So we know that social detox and medically monitored detox, which are both below hospital levels of care, are critically needed in our community. We need to expand our capacity for crisis stabilization services. And currently in our community, the only place that you can get affordable, accessible, intensive residential treatment for addiction issues is at community corrections. And if you don't know what community corrections is, it's a criminal justice program. And you have to have a felony, not just a misdemeanor, but a felony in order to get sentenced to community corrections. So not only are we criminalizing people for having chronic illness, but we're making felons out of people to get treatment for their addiction issues. Lovely. Right. Here's the beauty. They're doing a really good job of treating people at community corrections. They've got good outcomes. They're saving lives. You have got to go through the criminal justice system to get treated. Now, how about if you had cancer or asthma or diabetes and you had to go through the criminal justice system to get the care that you needed? I think our community, again, would be in an uproar.
And it's hard for these people to get jobs once they've got felonies.
Exactly.
It is a vicious, vicious, complex cycle. So this initiative plans to fill those critical gaps in where we don't have the services now. It is to not duplicate or be redundant or competitive with any healthcare or behavioral health care provider in our community. It's to work with them and bridge the gaps so they can do their jobs better and do a handoff to the next level of care that's needed that's currently not available. So at Mountain Crest, inpatient psychiatric hospitalization, they do a great job. They're busy, they're full, they've got a lot of complex cases, and they're doing some things that they probably wish they didn't have to because the care is not available anywhere else in our community. When they get released from there, there's a wait list, 8, 10, 12 weeks, kind of depends on the time of year, to get into the next level of care, intensive outpatient or outpatient care, right? Because like any other chronic illness, there isn't a cure for these things. You don't just go get fixed and then you're done. This is a lifetime management plan that's needed to take care of some of these issues. And so we know that the next level of care is what's going to help keep people out of crisis. It will help keep them at stability and in recovery, which don't cost a lot of money. So our goal is to make this investment in the community, get the long-term funding that we need, and be able to get upstream from the problem, do the early identification, early intervention in our schools, and making sure that teachers are capable of teaching and not having to be everything to kids while they're in school to learn. Making sure that kids are on the right trajectory to become successful adults and successful parents, to reduce this suicide epidemic that we've got in our community by getting upstream from the problem. Making sure that crisis isn't the only place that we've got services that we're giving help soon. And this tax would be for 25 years. It would give us a long enough time to get contracts in place and the services, and to really start gathering the data to show the improvements, the return on investment that this small amount of an investment would make in our community. Some of the models that we followed around the nation show results like 64% reductions in emergency room use by people with behavioral health issues. 30 to 40,000 jail bed days a year saved. at $120 a day, multiply that by 30 or 40,000. This is a significant amount of money that we're talking about. Reductions in loss of life, reductions in ambulance calls, and crimes committed. The return on investment is just, it's infutable. Is that the right word? Indefutable. Can't argue it, because there's good programs out there that we plan to follow and to role model after.
So you talked a lot about upstream. That's our world, being a prevention organization. And the reality of that is, and I'll share a little story about, I had a meeting with the director of Rocky Mountain HIDA, High Intensity Drug Trafficking Area, Tom Gorman, pretty well known. He puts out some publications around. He said, from a law enforcement perspective, when talking about the drug issue, the enforcement world and the treatment world are always going to fight over the dollars. And he said the problem is we'll continue to do that, but the world that can actually make an impact is you guys. And he pointed right back at me and said the prevention world. You guys can actually make an impact. The problem is, one, we're disorganized and we don't have the funding. And I go back to it, and we've applied for funding and haven't been funded by some of the major funders because everybody's funneling dollars into the treatment, the crisis, the what's happening now, and less of the money is going into how do we work upstream. Is there plans for prevention in this mental health campus and working in that and kind of a continuum of care?
Absolutely. We believe that there's got to be, not to be too cliche, but like a multi-pronged approach to this, right? We do need some better crisis care and detox. We don't have it in our community. Yeah. But what we really know is that the best use of this investment would be to put the money back into the community and improve the services at an early stage. We know the research says that most mental illness, 50% or plus, 50% or more mental illness can be diagnosed by age 14. Over 60% can be diagnosed by age 24. So we know that these things start young, right? If someone has bipolar or they've got some stuff going on in their family, and if these things, just like other chronic illnesses, aren't attended to early, they continue to get worse and people continue to get sicker. But if you can get people on the treatment that they need early, then you don't end up with them being in crisis care later on. So right now we need both. And the ultimate goal would be that we would do such a great job in the community in early identification and early intervention that we would need less crisis care later on. But it takes time. This isn't a quick acting project that we're talking about here. This may be generations before we start to see some of the true reductions. But what we know is that there's a lot of people in the wrong pipeline right now, right? That are going to end up continuing to fill our crisis system. So our goal is to get upstream from these problems and do the most intervention that we can to make sure that we're reducing the number of people in crisis later on.
Absolutely. So I can speak from my own perspective, but we do have Officer Wren from Fort Collins Police. Do you mind coming up and sharing a little bit about what you guys see on in law enforcement and how you traditionally have handled mental health crises, and what the options are? Just kind of giving a real perspective or current day perspective on how you deal with mental health crisis.
So, I'm not trained up or skilled in the mental health side of things. In the time that I've been a police officer, I know that I can agree from my experiences on what you had mentioned about the recidivism rates, as far as folks finding their way into the detention centers for whatever types of things, whether it be some type of a property crime, some type of a person's crime, whether it be a drug offense solely, and then immediately upon their release, that person has a propensity to go back to what it was that ultimately got them there in the first place. So in my career and in my experience, there becomes this recurring theme of names and experiences and contexts, and it has become evident to me that you cannot arrest your way into a solution on the issues of addiction. Which has prompted for me some work towards on some of that upstream intervention. As part of our neighborhood enforcement team at Police Services, and in working with school resource officers, we're working on programs currently to try to get the education into the schools, into the hands of parents, students, staff, faculty of schools on what to look for. Options as far as, if I've made my way down this path, where do I go from here? Prevention, one of the things that we've talked about is the social norming, and the idea that everyone's not doing it, and trying to get in front of it, because I would agree with you. I don't think that. I think the more effective approach to the issue of substance abuse is on the prevention side, not on the reaction side.
I go back to when I was in law enforcement and you were at the jail, and what you mentioned at the beginning of I'd arrest them and take them in because that's what we did. I mean, that was and then hand them off to Lori, and I didn't have to deal with it anymore.
A hammer is the only thing in your toolbox. What are you going to use, right?
Yeah, exactly. And working with some of my colleagues back then, one of them had said, working narcotics enforcement, it's a merry-go-round. If you don't catch them next time or this time, they'll come back around, and that was really the case. And I say this all the time. It didn't take long for me on the enforcement side to go, okay, this is fun. I'm having a good time in my career, but this really isn't solving the problem. How do we fix the problem? And that's why I ended up on ultimately on this side of things, and on the prevention and hopefully trying to intervene before, because we saw so many people just come back around and we weren't really solving the problem. We started to see drug courts and things like that, and this was in the 2000s, early 2000s.
Part of the criminal justice system, right?
Yep.
My career, same thing. I could say me too. I get tired of seeing the same people coming in the jail again and again and again, and then eventually you'd read about them in the newspaper that they died, And when I first started, I'd ask when I'd see someone come back, and I'd say, "What'd you do this time?" And by the end of the time, before I left the jail, I started asking, "Where did we miss it this time?" This isn't all on you. This is a societal. This is a system problem, right? And we're not recognizing. We're not catching what the problem is. It's not just you, it's you and us. It's a community that needs to solve this problem, because it's the community that's being burdened, and it's complex, but it's got to take changing the way that we're doing things in order to make a difference. We can't keep doing the same thing and expecting to get different results.
Yeah. I'll share one story. First time I arrested this individual, and I won't share the name because privacy, but first time I arrested this woman was back probably in 1999. Then worked with her as it related to another case into 2000. and then the last time I arrested her was in 2004 for substance related. Don't think she ever got any help, any treatment for her addiction. Back then, her drug of choice was methamphetamine. Don't know what her last drug of choice was, but I was saddened to hear it was about probably 9 months ago that she took her own life in the jail. I mean, how many lives like that are we going to lose along the way?
Yeah.
Well, I want to thank you both for being here and having this conversation. Is there any questions from the audience about the Mental Health Matters Initiative, mental health issues, law enforcement?
Can you discuss any of the youth portions of that facility?
For sure. So this project has got kind of two lanes to it. One of them, and I want to emphasize, is a lot of effort that to be made in the community to find the funding options, funding priorities, and infuse these services through early identification, early intervention in the suicide prevention piece, right? In the community. Through contracts, through grants, through creative funding means. We're in conversations now with the school districts, Thompson, Estes, Pooter, and saying, where can we bolster what you're doing so your teachers can teach, so kids come to school ready to learn? And we've heard things, everything from we need better curriculum and we need more staff, more case managers, more actual crisis counselors to help intervene so teachers can continue to teach and these kids can be given the help that they needed. Clear down to we've got a student homeless problem and we need to get these kids some help that are homeless because they're not coming to school ready to learn. They're coming to school with food instability issues. They're coming to school hungry. They're coming to school needing clothing, needing housing. So we're learning all of the pieces where there's critical gaps in our school systems, and that's where we hope to improve some of those coordinated efforts. The other part of this project is in the facility, in this hub of crisis services, and that, you know, a 20-year vision to have a campus of services for folks that need those more intensive levels of care, up to and including permanent supportive housing, partnerships with our housing authorities and housing catalysts that are able to get funding to build permanent supportive housing structures, but for this project to be able to provide the funding for the support staff that makes those projects so successful. So the hub of crisis services would have across the lifespan ability to care for people of medically monitored level of detox, social detox, crisis stabilization, or this intensive residential treatment care. What we know is for kids, they don't need institutionalization. They need integrated successfully back into their worlds, which for kids it's school and family, right? So the big goal of this project is really thorough assessment by experts that know the behavioral health field, both sides, to be able to look at the people that are coming in need and saying, where are all of your risks, where are all of your strengths, and what do we need to wrap around you to make sure that all of your systems are talking and you have the best chance for success. So it's kind of a two-pronged approach in the community as well as in this facility.
I guess two things. Number one, it sounds like what we're actually doing is dealing with the new emerging definition of trauma. And number two, with the complexities that I'm hearing, we're also looking at final solutions are going to be what I'll call a combination of government, NGOs, religious organizations, all of them together working to fill all the gaps and deal with the multiple sources of those problems.
Yeah, you're hitting it right on the head. When you talk about the programmatic level, that's getting a little bit in the weeds for now where we are. Our plans are, as soon as this thing passes, that we would really get into the programmatic side of things and talk about evidence-based programming and strength-based approach and a trauma-informed care, gender-responsive approach, and following all of those best practices that we know have really good outcomes attached to them. When you talk about the partners, that's what we're doing so well right now, and what the county has been great at is convening this conversation in the community with partners like Team Wellness and Prevention and our other prevention partners and our intervention folks, right? Summit Stone and Heart-Centered Counseling and UC Health and Kaiser Permanente. And when we're bringing the people that are providing care to the table and saying it's going to take all of us to solve this problem together, and we know that we can all benefit from this project, so how can we most successfully co-create this solution? We're bringing our municipalities together. We're talking to the city councils in Fort Collins. Their Department of Social Sustainability, tremendously invested in this project, know the benefits that people are going to see. In the city of Loveland, their city council they were the ones that came out with the first proclamation declaring Mental Health Month of May. Very excited about some potential improvements and partnerships with our municipalities as well. So it absolutely goes to show our partnerships in the community are what's going to make this most successful.
Any other questions?
Can I take a photo of this? for
Oh,
our
absolutely.
page? You guys mind?
Excellent. Thanks again for coming. Thanks for coming up and kind of being put on the spot, Chris. I appreciate it. I think it's important to as we have this conversation, you start putting law enforcement in there as being part of the solution. So I appreciate you coming up and Lori, obviously thank you for all that you're doing with this initiative. Like I said, my background, I remember having to drive people over to detox in Greeley. It was a inefficient way of handling things, and I'm glad maybe we can solve that and many more problems with this mental health initiative. So
Yep.
thank you very much.
Thank you very much.